A wax rim, basically, we end up taking an impression first of the edentulous jaw, which means missing, whatever teeth is missing. And then the lab sends us this kind of base that has a wax rim on it. And the wax rim is basically going to bite together, and I'll show you here in a second. And it's going to make up basically where the teeth are going to go when they're actually created by the technician. So it's really important for us to get a good facial height. It's really important for us to get a nice contour on the face. It's really important for us to get a midline, canine lines, a smile line, give the technicians as much information as possible so they can choose the right size teeth, and they can make sure that the way that they're biting together is actually congruent with how the patient actually normally functions. So that's the appointment that we're going to do today. Very, very important to be aesthetically inclined when you're doing this stuff, because this is going to serve the patient potentially the rest of their life. And every little step of it matters. It takes a little while, but it's super, super important. So this lady has a bone spur that we're going to take care of first, because I don't want her to feel the pressure of the actual denture on there. Open. I got you, don't worry. Look. So we're just putting this topical anesthetic into this area. So the important thing to know about topical anesthetic is it really only takes about 30 seconds to sink in, and it takes about 2 or 3 minutes for it to wear off. So there's a very short window of time where that stuff is actually useful. And the importance of realizing that is if we set up a patient and we put the topical anesthetic in and then we actually see them 15 minutes later, then they're just gonna have to put that nasty taste back in their mouth again. So very, very important to realize, put the topical anesthetic on, maybe even make the dentist do it before they're going to do the actual shot so that it causes the least amount of discomfort for the patient in general. Go ahead. Close your lips. You okay? Mm-hmm. Local anesthetic sinks in pretty rapidly. So I just gave this lady a shot maybe, 30 seconds ago? Mm-hmm. And you're probably already starting to feel it come in, right? Yeah. Yeah. That's the other thing. When you're first starting off in dentistry, we assume that local anesthetic really takes a lot of time, like it's like taking a pill. But no, you're getting it right to the source. And that means that it's basically almost instantaneous, that it actually has the effect, the desired effect. So new dental assistants, new people in general, very, very important to realize dental procedures can move faster than you think they can. But obviously ask the patient if they're comfortable first. Are you okay? Mm-hmm. Do you think you're numb enough to wiggle the guy?
Yeah, I think so.
Yeah?
Yeah.
You sure?
Yep.
Okay. Does that hurt at all?
Mm-mm.
That was it. Okay?
Is that it?
Yep.
Nice.
So that was called a bone spur. Bone spurs happen after extractions very often. Because it's basically the alveolar bone that's around a tooth will break off in certain chunks. Can I get a mask? They'll break off in chunks, and then you gotta make sure that it's all cleaned up for the patient so that they can actually do it properly. So these are wax rims. Okay, there's one for the mandible, one for the maxilla, for an edentulous arch. Okay, open. And Hannah right now over there is setting up the scanner, which is going to be very, very important for making sure that we can actually get these into the system. You okay here? Any pain? No? Not really? Okay, open big. All right. Go ahead and bite together. Okay, so you see how that's like wide open, right? So it's my job now to adjust this to the point where she can actually close her jaw, okay? So I know that I basically need to take the back down quite a bit on both of these. So alcohol torch, okay, needs to be filled up to about here for the wick to actually get wet. Very important. The other thing that's also very important is you are now dealing with flames. Be careful. I can't tell you the amount of times in dental school that I burnt myself on really hot wax or literally accidentally putting my finger in the flame. So you want to be very, very careful and position this appropriately so that you mitigate the amount of pain that you experience by virtue of trying to help someone, okay? I think a lot of people get into dentistry and they're like, it's fine, but you're literally doing surgery every single day, so be careful. So this is the first part of the wax rim. I know, ready? So I know that this was basically open right here, like it was like this, right? So how do I reduce that? I basically take down and angle this and angle that, and then these two are gonna come together. And I'll explain that in a second. So you basically warm this up. This is what they use to actually flip burgers and steaks at restaurants. But we're utilizing it to make this lady's occlusion, her vertical dimension of occlusion, the VDO, as accurate as possible so that she can enjoy this denture and doesn't even have to necessarily switch it out in the future. Okay? So I'm going to go over here. I'm going to go on the back and I'm going to angle this. And it's really important to put an even amount of force on the entire thing. Because you will end up getting lopsided if you don't. Well, you see that? Now it's a little less in the back. Still got the full height on the front. Right, I want to do the same thing on the other guy. Because that's just how our teeth are. It's called a curve of Spee. And when I drew it in the mouth, it's basically this like, it's like this curve that goes like this from the front to the mouth, or from the back of the mouth to the front. And you ever play that game Line Rider? Where you like, there's this little guy on a sled, you like draw lines and he goes and...
Yes.
Yeah. So I drew a little guy on the sled to remember. Whee! But on the whole, it really just comes down to what you think looks good and what functions in the patient's mouth, you know? Okay, so now we're starting to get a little closer, but relax your lips. Relax your lips. See how she's still way too open? All right, so now I know, okay, this is probably too high because when she's at relaxed, okay, open. So the other thing that I really emphasize when you're doing this is to keep it on the wax rim the entire time. Because if you only do one side, you're gonna get this lopsided thing, and then this thing, which is the Fox plane, is not gonna work very well. You're gonna be like, dude, this totally looks flat, but then there's a spot of it that's like, boop, and then it throws off the entire thing. So I knew, based on how she was biting, that we want only about a millimeter or less to show through when her lips are at rest of the wax rim, right? That's just gonna give us a nice aesthetic denture for her when we're creating it. So bite down. Interesting, open. Bite down. All right, relax your lips, close your lips. Yeah, still too high. Open. Okay. And this thing, by the way, there's wax on it. If you put it on this thing, it's gonna stick to the bib. If you put it on the bib and it hardens, it's gonna stick to the bib. So I always put it over the sink, the part that has the wax on it, okay? The other thing is, notice this. On the back side of the denture here, there's wax coming through. That's gonna change your vertical dimension. So you gotta get rid of the wax before you put it into the mouth again. See that, Hannah?
Probably just comes right off.
Yeah, but very important to also keep track of that because you might be fluctuating things in the mouth, but the millimeters and stuff are actually just being put off from the things that are on the base. Now, what I'm gonna do also, so I'm gonna take a wet impression and I'm gonna put it up here so that I have stability when I'm actually looking at these. Okay. You see how this area right here is all the way up here and this one's lower, right? So if you don't realize this, that our gums aren't like this, you're not acknowledging how awesome our mouth actually is. So we gotta make sure to make up all these gaps with light body material first. So you always put it on the edge first. And actually down here, you need a lot less material because it's already pretty accurate. So the edges matter a lot more. All right, and don't put a lot of material because they're gonna end up, it's gonna come out the back of the denture. And then it's gonna be really annoying for her. Open? I got you. Put your head forward. Yeah, there you go. You choking yet? A little bit. So I'm putting a lot of pressure here on the top. Right down the base of the denture, right in the middle of it. I'm putting a lot of pressure. And the reason is because I want to reduce the amount of excess material that's underneath, or that's sitting on top of the base that they created. I want to basically have as much show through as possible because I want to keep it uniform. So this stuff takes about 2 minutes to set. And you can tell if it's set. First and foremost, you should just look at the clock and be like, hey, it's 9:06. At 9:08, it's probably going to be set. Second of all, you can poke the material, and if it doesn't leave an indent of your nail, then you know it's set. So you see that? But you see how there's some show through in the back here. We got a little bit more structure here. The material went a little bit up higher into the vestibule in the areas that they need to. So you want to chop away the excess here as much as you can. Okay, so now we have a really accurate impression of the base of the denture. And if you look from the side here, you see how this is above that line? So you have to get rid of this material, otherwise it's gonna intersect with when you bite it together. So that's a little better there. And this again, just a little bit here. And what I'm gonna do here, put a little bit of super glue in the back. And notice this is gonna go into the patient's mouth, so please don't put super glue in places where that the material is not thick. But that should hold that in nicely. Okay. And if the base of it's held together, I don't have to worry too much about the sides of it. Right? Really important landmarks for dentures. There's this area right here, whereas our bone kind of pokes out right here. That's important to have relief there. This area is right here, is where our gums actually, when you pull the gums, you have this vestibule that forms over them. So this is the vestibule relief. Right back here is actually where a lot of the retention comes from the denture. This is your retromolar pad on your maxillary tuberosity. I think it's a retromolar pad. One of those two. It's in the back here. Okay, that's the thing that hooks in. Right here in the palate, you see the little ripples, right? All natural structures. Okay. Now we're gonna do the same thing. Need one more tip. So basically, light body 2 tips, medium body 1 tip, and then that's the setup.
This one.
Impression guns. You push this button, pull this shit out, and then you can take this out, okay? Careful.
I didn't burn myself. I just figured it was warm.
Exhibit A. All right.
Oh. I put the wrong one in.
Concentrate. All right. Bleed some of the material. Put it all along the edge here. We know that there's missing a lot over here, so I'm going to put a little bit more over here. This one you can actually do a little bit more because it's going to sink out the back anyway. One sec. Remember, even pressure on both sides. Very, very important. And you want to put a decent amount of it. You okay, love?
Mm-hmm.
You want to put a decent amount of it because, again, you want to get as little material between the gum and the actual, the base that they created for you. You always push to the front or pull to the front and let it release out the back. You okay, love?
Mm-hmm.
So you see how little material is in between here? Right? Very, very important to see that. But that also makes this a little finicky, so you want to be really careful when you're reducing. Again, we're going to take this off so that it doesn't interfere with the occlusion of the actual jaw. Okay, and then this guy as well. See that? You see what I'm doing, Hannah? Mm-hmm. Yeah, this part's important. Now I'm going to look around for loose places that it's going to be important to have super glue. And really, when we do this in the future, we'll have VPS adhesive, which we'll put at the base first, so that we don't have to go back and put super glue on afterwards. And I'm taking all this stuff off so that we can see the actual occlusal rim. Okay, so we have something nice here. Now I'm gonna put this back in her mouth and see if the vertical dimension has shifted at all. Open. Fitting better? Okay, bite. Close your lips. So it's still a little open, right? Still a little open. But I like the exposure here of the teeth in the front. So I know that most of it really is coming from this area in the back here, because she's not biting on that side. Okay, open. But I also want to test whether or not it's stable. So, bite. All right, watch out. I'm going to go over here. So, now from this angle, open. Bite down. From this angle, right, this line needs to probably be a little bit higher on this side. So when you go straight on here, you got to make sure that your fox plane is equivalent to what's going on with her mouth, okay? You see that? So I know that this needs to come up a little bit and this side needs to come up a little bit. Open. Open big. Again, take it out back first. So I know that I wanted to bring it up a little bit on that side, right? And I also know that she was biting really hard on this side in particular. So that means that these two on this side, the bite's kind of like this. Okay? That's what's going on in the mouth. So we got to be aware of that and adjust accordingly so she can actually close down. This side right here. It's always hard getting your orientation in the mouth right. And that's something that dental students struggle a lot with too. But the better you get at that, the easier your job becomes. You see all that extra wax coming off too? You want to make sure that that kind of comes off because it's going to come off on the denture. See if that made any difference. Bite. Just bite. Yep, bite all the way down. Just relax. It's starting to come together. You guys see the difference now? Right? She's starting to close. It's starting to look a little bit more natural. Maybe there's a little extra material up here, but I know that. We can take that away when the denture comes in. But look at me, love. I still know the video is a little high. It's probably about 1 millimeter high. Okay? But she's got a lot more structure here. Right? When I look from the side, you got to look from this view. Right? When you look from that view, what you're looking for is right over here. Okay? You want to make sure that it's not acute. So if the angle is going like that, if it's going like that, right, that means that there's too much material here. But this angle is obtuse, so we're good. On top of that, there's enough structure here to where the entire face is kind of coming together normally, right? Naturally. And I know that I want to take it down uniformly all over. My burger flipping days. Get all that shit off. This is the fun part about this too, because like, dude, when this lady gets her teeth, I can be like, oh, hell yeah. My understanding of aesthetics and what I like to see in the world actually made her face exactly what she wanted to, right? And that's the power of doing these things for people. I think we vastly underestimate our role in society as dentists and dental providers, but this really does change someone's life drastically. Mm-hmm. If you do it right, it can fundamentally change how they think about themselves, how happy they are to see themselves. You know, it's a drastic difference. So bite down. Yeah, now we're starting to look natural. You guys see that? You see how it's like, now it feels like, okay, this is what a face should be, okay? Do you feel that too? Mm-hmm. Right? You're like, okay, this bite kind of makes sense, right? So if she opens a little bit, you see a little bit of exposure here of the top teeth. That's really nice, right? And you don't see the bottom one, so that's pretty good. So we're in a situation where like VDO, vertical dimension wise, we're in good shape. Now we want to see if we got the lining right. Bite down. Okay. Now if you look straight on, right? Hannah, what do you think? Is it straight? Is it perpendicular to when you look straight on?
I think so.
Yeah? All right. Watch out. Let me see. Yeah. So we're like right on. So these are perfect. Okay. I want to create the where the medium body material is going to go in and hold these two together, right? This guy already has these nice two holes in it. We're good. This guy, not so much. So we got to make divots. It's actually kind of better with this thing. And you want to make them further back if you can, because we're about to do the midline, the smile line, and everything else, and you don't want that to interfere. Okay. And mind you, over time, this process gets a lot easier. How much time did it take me to get this process down? It took me 2 years. 2 years. Okay, so if you're getting impatient, oh my God, I can't get this wax to go like this. Like, bro, grow up. You got shit to do. Get the reps in. All right, so we got some little divots here to hold in. Right, we got some little divots here to hold in. Okay, the medium body material in general. Okay, guys? The last step is marking the sides of this. So you gotta make sure that you have some sort of discrepancy on the wax rim itself so the camera can pick up that, hey, this is that side and this is the other side. This is probably the hardest part about the process, is actually knowing how the machinery works and what a good scan is and what the scanner is looking at in general. Right? So when I make these lines, the scanner's gonna be like, oh, this is different than the other thing. Great, now I know where I'm at. Blades, put them away first. Okay. Ooh, see that wax? It's gonna throw you off. One sec, love. Okay, bite together. I'm just gonna mark your midline. Yep, I like that midline. To the sides of the nose here. Right, that's your canine line. And sometimes it's actually a little bit wider. So I'd say your canine comes to right over here. Okay. Tip of the nose. Canine line. You okay? Mm-hmm. Now the smile line. Give me a smile. Okay. So the smile line's actually in the yellow material. Yeah? Okay, Okay, so the way that I'm going to mark that is... So she bites together more comfortably. You notice that it shifted a little, right? You notice that the midline is a little different? All right, so one sec. Go ahead and smile. A big smile. There you go. Okay, so now they'll have an estimation of where the smile line is. Okay, take a picture of the side of the face. Nope, not like that. You want to go a little lower. There you go. That's what they're looking for. Okay. So first, anytime that you're doing anything with a scanner, you want to make sure it's about as dry as possible. All right. Now, these are ready to rock. And we're going to go to adjust bite rims and fit to bite to... Yep, we did that. We did that. We marked the midline, removed the bite rims. Cool. Scan lower bite rim. Lower. And it's going to tell you, you always want to go here, and then you go here, and then you go here, okay? So. Always make sure that the scanner is plugged in. If it is not plugged in, you're going to have a really, really hard time. All right, I want to capture as many details as possible in the area that I'm in, because you're going to need them later. And you notice my little glove fingers are there. Don't worry about that. Okay, we'll get there later. And then you go to this side, you scan all the way to the bottom here. You go over here. And you can stop. If your positioning's weird and you know that you're going to mess it up, you can stop. Because guess what? If I go back over here, it knows exactly where I'm at. So I can just go on the side. And that's the beauty of having unique landmarks when you're scanning things. Because the uniqueness actually tells the thing, hey, where the hell am I? Okay. Now I want to give it depth. So I'm going to go and scroll down here. And I'm going to go all around the first edge. And I'm going to be like, hey, this is what's going on. This is how thick this material is. And most of the time, it's really not all that complicated. Sometimes it is. Sometimes I don't know you. But most of the time, Dandy's a good boy. Okay. Now I'm going to go over. I'm going to finish off. Again, depth. I also want to include a little bit more details in these holes. I'm going to look around. If you double, you can move it. Double finger style. Okay. So it looks like I captured it pretty good. Looks like I know what I'm kind of doing. Hell yeah. Okay, next one. Bite rim. Capture the upper bite rim. You're going to start at number 1. Where's number 1? Number 1. Okay. 1, 2, 3, 4. Okay. Start at number 1. Capture the inside. 2 hops this time. Slide to the right. It's actually a lot of fun when you know how to do it. It can be. It's just, you got to know how to do it. Yeah. True. It's so cool. All right, now what? I'm going to give it some depth. Be like, yo, this is a 3D object. And guess what? It lost it. Right? So if I go to the bottom, what the hell happened here? Oh shit, there's a whole nother face in here. Okay? So you got to go to trim. You got to be like, oh no, I made a mistake. I didn't get the child the right information. And you go over here and you're going to just erase this stuff. And notice the directionality of where I'm doing this, right? If I did this, I'm done with trimming. If I did this when I was like this and I just, you would erase your entire, it goes all the way through, okay? Do not make that mistake. So, we'll start that again. We'll go to a landmark, it recognizes. Hey, it recognizes that landmark. I'm going to go to the side. And say, hey, I'm about to give you some depth, sonny. Gotta read a book. Okay? Notice how I'm cutting all these little angles. All right. If I put in all this work and my patient had to sit there for that long, do I want to miss any of the information that's available here? Probably not. Okay. I think we're pretty good there. All right. Notice my fingies. It doesn't matter. And there's some areas here that need a little bit more definition as well. So I'm going to go back to a landmark at truss. Yeah. And I'm going to go back and scan this area. All done. That's what my brother's kid says when he's done eating. All done. Now, what's the last part of this? Guess what it tells us? Next scan. Place bite ring back inside patient's mouth. Next. Take bite registration using blue mousse and trim excess material. So, blue mousse is actually the better way to go. Hopefully by the time you guys are watching this video, we have blue mousse in the office. But we actually go with medium body. So, first step, put on your mask. Second step, open. Put the thing in place. Open. Ooh, 1 sec, I got you. It's a little thick back here. Okay. All right, now bite. Still feeling normal? Mm-hmm. You look so good. All right, let's check this out. Oh, just cocking the gun. So I'm basically just gonna squeeze this material and I'm gonna say bite, and you're just gonna bite normally. Okay. And that's gonna indicate how they're bitten together. You don't want to put too much here when you're doing this, because the more that you put, the worse it is for you. Okay, bite down normally. There you go. Just bite all the way down. You're good. Close your lips. Yeah. Stay bitten. The more material that you put in this circumstance, the worse it's going to be, because you'll have to trim away the excess for the scanner to even know what's going on. So you really just want to put the smallest layer that you can, make it work like that. So again, it takes about 2 minutes to set. So it's a good time to talk to the camera or your patient and just be like, hey, how's life? And they're going to be like, I can't talk to you, dude. Yeah. Hand motions. All right. Just open your lips. Yep. Nail technique. Because I'm not a fond of clocks. A fond of? I don't make the fond of. Yeah, and the other thing is we don't want any wax in the sink.
Yeah.
I just realized that when I was doing that.
I always wipe it out of the sink.
Yeah. Don't put wax in the sink. Bad move. Leave it on the blue thing. And also, this guy right here, try to keep him as straight as possible. Don't put him in your backpack. Aha. Okay, now I'm going to take this whole thing out in one piece. Open. There you go. Open, big, big. You're okay. You guys see how I did that? I went all, you okay, Clifton?
Yeah.
And so I went all the way in here, and then I just torqued it. So the suction on the back releases, I can take the entire thing out, okay? Very important. Now, question to you. Pause the video if you know what I'm going to do next. And ask yourself, what am I going to do next? What I'm going to do next is dry the thing. Dry it. Why? It's slippery. 2, the scanner has a hard time picking up wet things. Okay? Now, if you see here, there's a lot of material that's over where I need it to be. Okay? So what I'm going to do is I'm actually going to separate, because I know the bottom one has those big holes, so it's probably going to stay attached to the bottom one. Probably. Yeah. You see that? So I separated, the bottom one's attached. I'm going to go through with my handy dandy scalpel and I'm going to chop away the excess from the outside. All right. And you might be thinking, Turab, you're taking away too much material. I'll be like, no, you're just inexperienced. So the reason that I'm doing this is I want to tell the scanner, hey, we got things here that you know about. Remember we talked about that thing? The scanner's like, yeah, I remember. And then when you put this back into place, you still got the bite, you still got the things on the outside, and we're ready to rock with what it's asking me to do. Now I start scanning the thing. So now that you took this apart, you have to make sure that it's actually the right orientation. But it looks like a class 3 bite here. I don't think she has a class 3. We might need to retake the bite. Open. Okay, bite. Close your lips. Yeah, are you biting differently than you did before? No? Right, move your head. Okay, open. Let's take this guy out first because it's easier. So yeah, so she's biting appropriately. And I'll tell you guys different in class 1, class 2, and class 3. It's basically how the lower jaw is positioned compared to the upper jaw. Okay. What was that? Okay, so it's saying scan that side first. And so I will. Oh, look, I already found one of them. Now let's see if it finds the other guy. And the key here is to go underneath. You see? Because it has a 3D understanding of the thing. So we got one bite. We go to the second bite. And it tells you, look, maxilla over here, mandible over here. Maxilla has a lot more. I'm going to go over here. Come on, I know you know my marks. Nope, doesn't know my marks. But it does know. Aha! Inside. And go over here. And say, hey, do you know this one? It's gonna be like, no. It's like, come on, we had that talk. Right? Yeah, remember.
So next up we're gonna do is we're gonna confirm a tooth shade. So this is the tooth shade that we normally pick for full dentures. It's B1, it's our lightest shade. Is that good with you? You like that one? Okay. That's just our typical one that everyone gets when they get full dentures. You'll hit next. And then you'll look at her tissue shade. So then I'll have you go ahead and open for me. So she has, I would say, a medium pink, original pink, yep. And then signature dentures, straight to finish, lab choice. And then you want to do medium. And she does not, that is a gap. She does not want a gap, correct?
No.
Okay. Leave as is and leave as is. And then that's where those pictures that I took earlier on the phone, you'll just go ahead and upload them. You'll scan the QR code, add photos, photo library. I already took them earlier. I just select the 2 photos that I did, and then I'll hit finish, and then they're uploaded. And then once they pop up, you can hit next. No, she does not need a design preview. Proceed to checkout. And then it will tell you that they will be here Wednesday, June 11th. So you can make an appointment any day after Wednesday, June 11th.
All right.
And then you are all set.
Thank you.
You're welcome.
So right now, Hannah's cleaning up here, right? The things that we made that we spent so much time and energy making, we want to put back in the box that Dandy gives us, and then we're going to put a sticky note with a patient's name, okay? Upon delivery, or you can just rip off the thing on Dandy that says their name. I'm not going to show you the name. But the importance of this is if anything goes wrong in the process, that we have a record of all the work that we did already, and then making sure that we can go back, right? When we deliver the dentures, then we can chuck this case, okay? Well, the denture case is actually useful because then we can clean it out. We can actually give it to people that need it, okay? So that's, you put this guy, put the name back on here, and then you go and put it in the sterilization room, okay? Other than that, cleanup-wise, Hannah will explain a little bit of things.
So you just want to make sure that you wipe down everything thoroughly. You want to make sure that there's no residue left. You want to make sure that you wipe down all of these instruments because they were in the patient's mouth. You want to wipe down everything, the chair, everything that a patient has touched or that we have touched. You want to make sure that it is wiped down. You don't want a patient coming in and sitting in residue of a denture patient, because how does that make us look, you know? Just to make sure everything is thoroughly wiped down. Sometimes I use 2, 3, but because this was just a denture patient, we didn't have any like really saliva, any blood, I will just use 1. But like for an extraction or anything else, I'll use maybe 3 to 4 and double wipe it as well. You just want to make sure you get all the crevices and the suction, take it out, wipe all of it, wipe where it goes. Even if they didn't use them, you still want to do it. Just to make sure that everything is sterilized, because you want to think about the patients and what would you do if you came into a dentist office that was dirty. And then we didn't use any of these, but I still want to wipe them down. And wipe the buttons. And make sure before you touch anything that you've already cleaned, you want to take off your gloves. This just goes in that cabinet.